Home care and home health care. Sounds the same, but boy are there big differences between those two. Home care is private pay generally. Also, long-term and care insurance is accepted by most home care agencies, but home care is definitely not a medical service. It's not a covered service under Medicare or any insurance plan other than long-term care. Home care is typically episodic, meaning that somebody's had an event or a medical condition or a changing condition that triggers the need for in-home nursing and in-home medical supervision and care. It could be physical therapy, it could be wound care, it could be speech therapy or occupational therapy. Maybe there's been a stroke and the ability to do things like brush teeth or get from bed to bath is now different than it was before that episode or that event. With home care, that is a service that is generally paid privately or through long-term care insurance. At Homecare of La Jolla, we do work very closely with several long-term care insurance companies, and we'll arrange everything on behalf of our client. Home care is not something that your physician prescribes, but they might recommend it based on somebody's ability to take care of themselves and stay healthy and prevent things like hospitalization or slip and falls or other medical events that could be prevented just by having some care and supervision and companionship in the home. With home care, that service is really directed by the self or directed by your loved one that's arranging for the service. So you have your choice with home care, how many hours you'd like this to be, whether you want somebody to be a live-in or durational services that could be a couple days a week, just 4 hours a day. Home care is really a wide open playing field between the consumer or our client and a company like ours that provides that service. We can do what you like, as you wish, providing exactly the sort of caregiver that you want and prefer, and for as many or as few hours as you'd like per day or week. With home health, it's much more of a rigid structure. You're much more part of a system. It's different than home care. It's medically inclined, and it isn't something that you can self-direct. It has to be prescribed by a physician. A discharge planner or a case manager at a hospital might prescribe this as well. And these people would come out for a certain set period of time based on your medical assessment and provide sort of a bridge from where you are on one side of the river to the other side of the river. And it's durational, it's limited. It doesn't include things like activities of daily living or in-home nursing that's anything more than, say, an hour and a half or 2 hour visit. There are government limits on how much home nursing you get, and the nursing isn't really for that person, but for that person's condition. With private home care, another option is, of course, to have an LVN or an RN come out and deal with those medical conditions that might be addressed by a home health agency in a durational manner, but making it consistent. So instead of home health telling you you've qualified based on certain criteria, certain diagnoses for, say, 2 days a week of 1 hour a day of nursing for whatever the condition is, with home care, where it's private and you're paying a company to direct as you'd wish, we can come out and really advance that treatment, that care, that supervision, and provide sort of an eyes and ears between the physician, the client, and the condition to help speed recovery, to help prevent things, and to help keep somebody really safe and secure and give peace of mind to themselves and their loved ones for as long as you wish.